Now for stretches. We've worked out and we want to finish up with a nice light stretch. We've got a few of those to go through. The first one is that Thomas Test stretch. So everybody pretty sure is familiar with this one, where we've got our patient just barely sitting on the edge of the plinth. They grab their leg that we don't want to stretch, and the leg that they do want to stretch is going to be hanging off of the plinth. They slowly just lower back and just let that leg fall and get a nice stretch. They can intensify it by trying to bend that knee or have someone passively bend that knee to really hit that rectus femoris a little bit more as well. Fencer and modified fencer stretch. So the true fencer stretch is one, again, we kind of went over this in lab, but where you're actually kneeling down like this and you're really leaning into it. You're trying to keep that body as upright as possible, just so that we can get more of the hip flexors, and we're getting that rectus femoris. Again, if we want to intensify it, I'm not going to because it'll kill my knee, but we could grab our ankle and pull it up to really intensify that rectus femoris stretch. Fencer or modified fencer stretch is actually the one where we are kind of in that similar position, but we're standing this time. So we're going to lean forward, we keep that leg back, and then push our hips forward as we can tell our patients to go into kind of a posterior pelvic tilt, as well as trying to keep that body more upright. We don't want them to lean forward because then, of course, it's going to decrease the intensity of that stretch. That's a simple one if they've got some pretty tight hip flexor muscles and we don't have the ability, or we don't have the ability to get down on the ground, then simply just taking a step forward while they keep upright and push those hips forward can really give a nice good hip flexor stretch. So that's our fencer and then modified fencer. Knee to chest stretch. So this one can be used for, like, if we want to get a good lumbar stretch. We can do it bilaterally and unilaterally. So if we want to just do one side, we can grab that one side and pull our knees to the chest. Note that I'm allowing that lumbar spine to curve, because that's where we want to feel that stretch, where we can do it bilaterally. And again, we'll allow that lumbar spine to go into flexion to feel that stretch. Quadruped glutes. So this one isn't quite as common, but it's still effective. You can have your patient, especially if they have really tight glute max, they can get into this quadruped position, and if they just push back, so they're kind of going to that prayer or that child's pose, and then they should feel that in their glutes, depending on how tight it is. If you want to intensify that, because the fact that the glute max is a good, strong external rotator, you can have your patient go into internal rotation, and not that we want them to W sit, but by intensifying it, having them go into internal rotation of the femur, then they should feel a little bit sooner than maybe if they just kept them in a neutral position. Wall slides for hip abduction. Everybody should be familiar with this one, but just in case you're not, you have your patient come up to the wall, butt right up against it, and then they just allow their legs to fall out, stretching the hip adductors. Short sit for glutes. So this one's going to be similar to the quadruped glutes, but this one, maybe they're so tight or they don't have the ability to get in the quadruped that just sitting in this position, kind of have them come forward a little bit, and then they're just going to lean forward. And again, depending on how tight their glutes are, they will feel that as they lean forward. Again, you can have them go into some internal rotation and bend forward to intensify that stretch. Butterfly. So the butterfly is something that's actually pretty common in dancers. They do this quite a bit, but essentially you're going to bring your feet together, plantar surface of your feet together, pull those heels in, and then push down or give some light push on the femur or close to the knee to again intensify it. Some people may just get into this position, they'll really feel it. If they don't want to push down, then have them grab their toes and they can just pull down. Again, it will really intensify that. So they can do it in a seated position, or they can do it supine. So they just lie down and let their legs fall to either side. Let gravity do its thing. You can push on it. You can do another stretch. It isn't on your sheet, but just thought of it with butterflies. It's called the frogs. Frogs are essentially where you lie prone in this position. So it's a similar position to a supine butterfly, but now I'm in prone position. And you can have them try and push their toes or their feet down to the ground. And it'll really stretch out all the knee or the inside of those legs. Piriformis stretch. So this is one that we've kind of talked about in both labs. Just a reminder, the common one is that figure 4. Is it as effective as people think? And so we do have just doing a long sit internal rotation, or doing that crossover where we're pulling it into more adduction and maybe a little bit closer to the body, as opposed to doing that full-on figure 4 type stretch. Hamstring stretches. You can do a straight leg raise with a towel. So although this isn't a towel, it's a sheet. We'll pretend.
It's not going to work.
It's not going to work. It's too long. So hook it around the foot, and then they lie down, and then we're just going to bring that all the way up to, again, make sure it's intensified, or to try and intensify it. We can have them keep that opposite leg straight down in contact with the plinth, and they can just pull it up as far as they need to get an adequate stretch. Another one, so this is a fun one, the doorway stretch for hamstring. Find a doorway. It's going to be similar to the abduction stretch, but now we're having the patient just bring their leg up like this. One leg that's getting stretched is on the inside of the doorway, the other one's falling outside of the doorway. And let's say I'm feeling a stretch there. To intensify it, I would just continue moving myself closer and closer to the actual wall to make it more intense. Seated, that one should be pretty self-explanatory. More of a long seat or a long sit, trying to reach down and touch my toes. Or standing, again, trying to reach down and touch my toes. With that stretch, just kind of as a side note, a lot of times patients will say that they really feel it on the back side of their knee, within that fossa there, the popliteal fossa. If we want to get a little bit more of a stretch focusing on the muscle belly itself, just have them come out of that screw home mechanism. Just slight flexion, not a lot, doesn't take much. But if I keep my knees straight and I'm going down, then that's really just going to be stretching out a lot of that posterior capsule. So to get more of the muscle belly, I can come into just a slight amount of flexion. You can't really tell with my pants. I'll tighten them up so you can see. Just a little bit of flexion. And then as I bend down, I can get farther, but then I start to feel the stretch up here in the muscle belly as opposed to on the back of the knee. TFL and IT band. So we've got sideline stretch on there. This one can be a little tough. Again, think about the TFL and the motions that it performs. And so we want to go into hip flex or extension, abduction, and then external rotation, because it does help with that internal rotation. So for a sideline, your patient essentially would end up looking like this, which is pretty tough if they're trying to do it on their own. So that would be probably more appropriate for if they're having the therapist do it for them. Standing, this one, let's say I'm going to stretch my left TFL. I'm going to put it behind my right leg so that my right leg can still support me but allow for some bend so I can really get into that abduction, and I can push myself into some extension of the hip and then try and rotate into some external rotation as well, to depending. This is another one where we've talked about some of those other rotation or muscles that have rotation component to it. Just try out each one of those motions and figure out which one intensifies the stretch most and have them stay in that position. The last one, foam roller. It's a favorite of, I think, just about everybody but me. I hate rolling out TFL. I'm not a big fan of foam rolling anyway, but you're essentially going to get the patient in the same position that they would be in if they were doing a standing TFL. So we still make sure that they're kind of externally rotating that hip, and then they just roll out all along that IT band. Just try and get a decent stretch out of it. Again, not my favorite, but if it works for you, then do it. Knee extension. This time we're talking about capsular stretch. And I think we've mentioned it before. If we're going for a capsular stretch, we should automatically think low load, long duration. So for this one, we're going to do prone hang, where you'll have the patient lying prone, and then they bring their knee to the edge of the table, and they essentially just let it, I'll use the other leg so you can see, let it fall off. So if I've got maybe a capsular issue that's stopping me right there, then I just hang out here, try and relax into the stretch. The next one is, what do they call it? Supine heel prop. So we can use our foam roller here. You can use a foam roller, you can use a towel or a pillow, whatever, and just have the patient put their heel on that and allow it to, again, just fall into extension. This is a really common one, especially with total knee patients where they're having a hard time getting that terminal knee extension. You just have them hang out here, and you can intensify it by putting some weight on it, having them explain to them that they just need to relax into that stretch. Quad stretch. So we already talked about the Thomas test stretch that you can do. You can do it standing as well. Again, I think we've kind of talked about this one, but to get all four quads, we can go there, and then if we want to intensify it, then we can have them pull back into to more extension to get that rectus femoris. You can do it prone as well. So now the patient's just going to be lying down. This one, if they have a tendency to allow too much hip extension and maybe flexion, maybe we want to just help them maintain more of a neutral position, and we can have them get them here. Now, if I'm tight and that's as far as I can go, maybe I grab a towel and I can loop it up around and pull myself into more knee flexion to get that quad stretch adequately. Knee flexion. Now again, we're still hitting the quads, but now we're or at least the position of the quads. Now we're looking more at the capsules. So again, we're thinking low load, long duration stretch. One simple one is just sitting back on their heels like that, as much as they can tolerate, or as far as they can tolerate. You can do supine wall slide, so similar to the abduction stretch. Pretend there's a wall right here. Got my legs up against the wall, and I'm just allowing them to fall into knee flexion. Rock forward on a step. So if we have, grab this, we've got a step there. Now our patient hold on to something, and then they just lean forward. Again, we're thinking low load, long duration, so they're going to be here for a little while, so make sure that they have the ability and the tolerance to stand in this position if we want to use that one. Or we can have them do it in a chair. This one's pretty simple and pretty common. Did this with a lot of total knee patients. Just have them plant their feet pretty good and then scoot themselves forward. And depending on how much flexion they need or how much flexion they have, even just that much might be a good stretch for them. Then once they feel like they don't really feel the stretch anymore, they lean forward even more, and then again it puts them into more of that knee flexion. They can do this in their wheelchair, roll up against the wall or roll up against a door frame, have their foot, and then they just go right up against the door frame or wall and scoot themselves farther forward in the wheelchair. Obviously that one has a drawback of you can only go to the point that you actually hit the wall or the doorway. Plantar fascia stretch. So this one can be done up against the wall, or you can have them come up to a leg of a table or anything like that. This one, you're going to have them as much as they can get their foot, so it's kind of in that position, and then really just push the ball of the foot down towards the ground. We're going to really try and extend those toes to stretch out that plantar fascia. So you can do it up against the wall, you can do it up against the leg of a table, you can do it with a towel or with a sheet. So they can do that with themselves. Same kind of thing. This one, a lot of times I'll have them put their leg, kind of use the leg as a weight, keep that towel or anything so it's not going anywhere. Wrap it around and really pull and get a lot of that toe extension as well as pulling them into dorsiflexion. Get a nice self stretch. That's an easy one for patients to just kind of hang out and do on their own. Another
your DIY Strasbourg Sock.
Yes. You like my socks?
Oh, the Strasbourg Sock. Remember that?
Oh, that's right. That one. That's right. We have a special sock, and if you're ever allowed to come back, then we'll bust it out and show you. But there's a sock that you can actually have the patient wear, and you can tighten it up and strap it to themselves, and so then they don't have to hold on to anything. It just does the work for them, and then as they feel the stretch decrease intensity, they just tighten it up and strap it again. It's pretty handy dandy. Another one that's really common for plantar fascia is using a frozen water bottle, and this is just to try and address the inflammation that might be going on as well. With that one, we'll pretend like this is a frozen water bottle, but with that one, they'll have it on the ground.
It's the prepper size.
That's right. They're really prepared. But they start at the heel, and then they apply that pressure and roll towards the ball of their foot and then back. And again, a lot of people like that suffer from plantar fascia or plantar fasciitis because of the fact that there is that ice component, and it helps address that inflammation part of, the itis. Ankle dorsiflexion, gastroc and soleus, so kind of similar to what you saw with the plantar fascia stretch, doing on their own. They'll just pull that again. If we want to focus more on the gastroc, just tell them to keep the knee straight, focus more on the soleus, have them bend that knee while they're still pulling themselves into dorsiflexion. They can do it seated, so similar to the knee, but instead of focusing on the knee as they push forward, we're just focusing and making sure that they keep that heel on the ground to push more into a dorsiflexion stretch. And then simple standing, like everybody's probably seen, just do a standing stretch. Again, like this, they lean into it. And then to get more of the gastroc, keep that knee forward, get more of the soleus, allow that knee to bend. I've been working on mine. How's it looking?
Impressive.
Like that. Ankle plantar flexion, so similar to knee flexion for capsule, where they're sitting on their heels. You can just have them, again, sit on their heels, and obviously that's putting me into quite a bit of plantar flexion at the ankles. They can sit in the chair, kind of similar to what we saw with dorsiflexion, but now instead of keeping the foot flat like that, we can just have them put their toes on, and then they lean down into it to get into more plantar flexion for that stretch. And let's see, next we've got Inversion E-Version. So they can do it just manually by grabbing their foot if they have the ability to bring it up close enough, or they can just pull into that inversion or pull out into the E-version. Or they can use a towel or a sheet. If they can't bring it up to grab, then they can pull up into inversion or out into E-version. Toe flexion and extension, again, typically this one's done by themselves. They're just going to grab their toes, push into extension, push into flexion. They can just grab all of them and hold them into either one of those positions. And that is all of our stretches. Quick and dirty. Huzzah.